Alright you guys, welcome back to another video lesson from ICU Advantage. This is going to be the third part in our series on heart failure, and in this lesson we're going to be talking about the left versus right-sided heart failure. And my name is Eddie Watson and I'm going to be your presenter for this lesson. But before we begin, if this is your first time to our channel and watching our videos and you'd be interested in more critical care education content such as this video, please subscribe to our channel below. Make sure you hit that bell notification though, that way you'll be notified as soon as our new lessons become available to you guys. And I really truly value your subscriptions, likes, as well as the comments that you guys leave. They really go a long way to help support this channel. And so for that, I do want to thank you guys. Alright, so like I said, this lesson we're going to be talking about the differences between our left and right-sided heart failure. If you remember from our previous lesson, we talked about the differences between systolic and diastolic heart failure, which have very different pathophysiologies but really manifest themselves in the same way, which is that decreased cardiac output. But when we get in and talk about the differences between our left and right-sided heart failure, we're actually going to see quite a bit of difference between these two. Because again, like we covered in that first lesson, when we talked about the flow of blood through the system, we have that blood that comes in via those veins into the right side of the heart, which the right side of the heart's job is to pump that blood to our lungs. From there, the blood becomes oxygenated, makes its way back to the left side of our heart, whose job it then is to pump this oxygenated blood throughout the body. And it's something that we'll get into here in just a minute, but depending which side of the heart it is that's failing, you're going to see this manifest itself in a different set of symptoms. And so when we're looking at this heart failure, we can really end up with two different things going on. We can end up with either a left-sided heart failure or a right-sided heart failure. Now also, as I had previously mentioned, you can also end up with both sides failing, which is what we refer to as our biventricular failure, but that's going to be a manifestation of both the left and the right-sided failure. And the things that you're going to see are going to be the result of the same things that you would see for both left and right-sided failure. And so because this whole system really works in a series, when you have one side that fails, that can lead to failure on the other side. Now, in the vast majority of occurrences that we see, what you're going to see is left heart failure that starts out, and as a result that this can lead into right heart failure. But while it's quite uncommon, you can also start with right heart failure and then end up with left heart failure afterwards. And like I said, each side of the heart is going to come with its own set of symptoms and issues that are a result of that side failing. Some of these issues that we're going to talk about are going to be related to not being able to move enough blood forward, which is as a result of that decreased ability of that particular side of the heart to pump and move blood forward, decreasing that cardiac output. But some of the symptoms and the issues that you're going to see are going to be a result of, while you don't have enough blood moving forward, you start to get that blood to back up prior to that ventricle, prior to that side of the heart. And so you're going to see symptoms that are a result of that blood backing up to the system. And so with all that said, let's go ahead and jump in and talk about the first of these that we're going to talk about, which is going to be our left-sided heart failure. Now, as we get into talking about left-sided heart failure, it's really important to know that about 2/3 of all the cases of left-sided heart failure are going to be a result of systolic dysfunction or systolic heart failure. And as I just talked about, we're not going to be getting enough blood, whether it's systolic or diastolic, we're not going to be getting enough blood pumping forward. And as a result, that blood is going to begin to back up to the system. Now, in the case of left-sided failure, we know that that blood is coming to us via the pulmonary veins after they've left the lungs and have gotten oxygenated. And so what we're going to see is a backup of the blood to the pulmonary circulation. And so as a result of this extra blood in that pulmonary circulation, we're going to see an increase in our pulmonary artery pressure because of all that blood being in that system. And since we have all this excess blood and fluid and this increased pressure, what we're going to see is this fluid shifting. And so this fluid is going to shift into the interstitial space in the lungs. And this is something that we call pulmonary edema. This is also something referred to as congestion, which is where you're going to hear the term congestive heart failure derived from. Now, if we look at our causes for left-sided failure, this is primarily going to be the result of diseases that are impacting the left side of the heart. So if you remember from our previous lesson, if you think about things like our coronary artery disease, cardiomyopathies, valvular diseases, specifically aortic stenosis or mitral regurgitation, since they're on the left side, it's these left-sided disease processes that are going to lead to the failing of the left side of the heart. Now, with that said, I do want to diverge for just a second here and talk about something that we really haven't addressed up to this point, and that's going to be our difference between our acute and our chronic heart failure. Now, for the most part, what we're going to be talking about in these lessons is going to be related to our chronic heart failure, and so a lot of the causes that we're talking about are these chronic issues that over time lead to this state of heart failure in our patient. But there can be certain things that come along that really have an acute nature to them and acutely cause this decrease in our pumping ability of our heart. And so I do want to just make mention of these here so that you have an awareness, but know that the focus of these lessons are really going to be on those chronic conditions and those chronic problems leading to our chronic heart failure for our patients. So some examples of these acute causes: while coronary artery disease tends to be one of our primary causes leading to heart failure, if you end up with these acute obstructions of coronary blood flow, that this can lead your patient to have an MI and then can lead them into a state of heart failure or acute heart failure. Other things such as drug toxicity, cocaine use, acute valvular failure. So if you just have a completely failed heart valve, then that can again lead to this acute state of heart failure. And while these acute causes can certainly have lasting impacts on the heart, oftentimes we can put interventions in place that can reverse the course of this heart failure because it is just an acute thing that has happened. So like I said, I just wanted to make mention of this. That way you guys had the awareness that there is this difference between this acute versus chronic, and the end result of all this for our patients can certainly have different endpoints. All right, so with that out of the way, let's go ahead and move on and talk about our signs and symptoms of left-sided heart failure. So a couple of these we had already talked about. First of these is our increased pulmonary arterial pressure. The other is going to be that pulmonary edema. Like I said, we'll often refer to this as congestion. As a result of this, your patient can have crackles on auscultation, or sometimes you hear people refer to these as rales. And this is essentially that poppy, crackly sound that you can hear in your patients when you're auscultating, especially in the bases on inspiration and expiration. Your patient can also be experiencing dyspnea or orthopnea. And this is going to be a result of that fluid, that pulmonary edema that's backed up into that interstitial space, into the alveoli, and it's taking up space that would normally be there for gas exchange to happen. And so as a result, your patient's going to be having a difficult time breathing, or having a difficult time breathing while lying down. They may need to sit up in order to feel comfortable breathing. And as a result of this fluid as well, your patient can end up having pink frothy sputum. Because as a result of that fluid being in the lungs, the body's going to naturally work to expel that out, and so that can manifest itself in your patient coughing up this pink frothy sputum. Now, up to this point, all of these signs and symptoms that we've talked about have really been a result of that backup of fluid prior to the left side of this heart as a result of the left side of the heart not being able to pump enough blood forward. So each one of these, like I said, is going to be a result of that fluid backing up, primarily in this case into the lungs. But if you remember from the beginning of the lesson where I mentioned that in addition to symptoms related to backup of fluid, we're also going to see symptoms as a result of the blood not moving forward. As a result of that, though, your patient may be fatigued, weak, or even lethargic. And this is primarily as a result of not enough blood going forward, the body not being able to get enough blood in order to be able to function like it's supposed to. You also can see a decreased urine output. Once again, this is going to be a result of that blood not moving forward, and so the body's going to attempt to try and compensate by increasing our preload, and the way that it does this is by holding on to our fluid, and the primary way of doing that is to reduce our urine output. And finally, you could also find your patient having either a rapid or irregular heartbeat. Once again, since that blood is not moving forward, the body's going to attempt to compensate again by increasing our stroke volume, and one of the ways to do that is it can increase the heart rate, leading to this rapid heart rate, which can sometimes also manifest itself in an irregular heartbeat. And so, like I said, when we look at these symptoms, you have to really think about two things. What's going to happen as a result of not being able to get enough blood out to the body, as well as what are we going to see on the left side when the left side is not able to move enough blood forward and it begins to back up into the pulmonary circulation. So if you really think about that process, it will help you to think through some of these causes for these different symptoms that you're going to see in your patient. All right, so let's move on now and talk about our right-sided heart failure. So in the case of right-sided heart failure, we now have failure of our right ventricle. So again, if you think about it, it's taken that blood from the rest of the body via the inferior and superior vena cavas, and its whole job is to pump that blood forward to the lungs to be oxygenated. But in the case of right-sided failure, we're not going to be moving enough of that blood forward. Therefore, we're going to see things back up into our systemic circulation. So similarly to when the left-sided failed and we saw that increase in the pressure in the system before the left side, here we're going to see an increase in the pressure in the system before the right side, which is going to be an increase in our central venous pressure. And once again, as a result, we're going to end up with a fluid shift as this fluid has built up and is looking for a place to go. And this is going to be what we call our peripheral edema. So now as we move on to talk about some of the causes of right-sided failure, one of these that we've already talked about is going to be our left-sided failure. And so what's happened here is as the left side has failed, it's caused an increase in the pulmonary artery pressure, more of that blood and fluid to build up in that system. And so this actually makes it harder for the right side of the heart to pump against. So in that state of that chronic elevated pulmonary artery pressure and increased fluid, that's going to create this constant state of increased workload on the right ventricle and can ultimately lead to that side failing as well. And this tends to be the most common cause for our patients to go into our right-sided failure, specifically into that biventricular failure. But you can also have these isolated causes. And the first of these is if you have some sort of left to right hand shunt. So think about our atrial septal defects, our ventricular septal defects, where that blood is going to move from the high pressure system on the left side to a lower pressure system on the right side. And so by this blood shifting to this lower pressure system, we're going to increase that blood volume on the right-hand side, and this is ultimately going to lead over time to that concentric hypertrophy, because now the right side has this extra fluid in there as well as it's more difficult for that side to pump with. Now, the other common isolated right-sided heart failure cause is going to be our patients with chronic lung disease. And what's happening here is as a result of these various lung diseases, your patient is going to be persistently hypoxic. Now, what our body does in response to hypoxia is it's going to cause constriction of those arterioles in and around the alveoli, which is ultimately going to lead to an increase in our pulmonary artery pressure. Once again, it becomes harder for the heart to pump against, leading to that state of hypertrophy. And this is something that you'll also see referred to as our cor pulmonale. essentially a primary right-sided heart failure caused by lung disease. So with that covered, let's go ahead and move on once again to our signs and symptoms of right-sided failure. And just like with left-sided failure, we're going to look at causes that are a result of blood backing up prior to the system, as well as signs and symptoms that are a result of not getting enough blood forward in the system. So some of these we've already talked about, like our elevated CVP, as well as our systemic vascular congestion. And this systemic vascular congestion, or this peripheral edema, we're going to see this manifest itself in a few different ways. The first of these, and probably one of the most recognizable signs of heart failure, is going to be our jugular venous distention. And this is essentially where you have those veins in the neck that are just expanded out, and just looking at the patient, you can see those veins. And this is as a result of having all that excess fluid backed up in there. Like I just mentioned, we have that peripheral edema. And this is where we're going to see that fluid backing up out into the periphery of our patient's bodies. And we're most likely going to see this in places like the feet and the legs, or if the patient is lying down in areas like the sacrum. And depending on the extent of the patient's heart failure, the amount of this edema can really build up to the point to where you can even have what's referred to as pitting edema, where the patient is so swollen and edematous that if you push in on their skin, like let's say in the lower leg, you'll leave an indent in their leg as a result of shifting that fluid out of there. You can also see your patients have something that we call hepatosplenomegaly. And essentially, this is this fluid backing up into the liver and the spleen. And this can oftentimes be very painful for your patient. This can also lead to failure of the liver and ultimately cirrhosis, as well as ascites, which is where that fluid can also back up into that peritoneal space. Finally, as a result of this backup of fluid, there's a good chance that your patient is going to be experiencing some sort of weight gain. So if you just think about that fluid as being stored elsewhere in the body where it normally wouldn't be, and this is going to cause an increase in your patient's weight. So once again, each of these that we just talked about here are going to be a result of that fluid backing up throughout the systemic circulation as a result of the right side of the heart not being able to move enough blood forward. But we will see symptoms manifesting as a result of not having enough blood going forward, and a couple of these are actually going to look just like they look on the left side. So your patient can have that fatigue, that weakness, or even that lethargy. Because while this is going to be the result of the body not being able to get enough blood, if the right side of the heart is not pumping enough blood forward, we're not going to be oxygenating enough blood, as well as supplying enough blood to the left side of the heart to be able to have a sufficient cardiac output on that side. Again, in order to compensate for this decreased cardiac output, you'll also see a rapid or irregular heartbeat here as well. But one of the differences that we will see, on the left side, we talked about having that decreased urine output, which we may see that during the day for a patient in right-sided failure, but particularly at night when they lay down, a lot of that fluid is going to shift out of the peripheral areas such as the feet and the legs and will be reabsorbed by the body, and therefore you can actually see your patients have an increased urine output at night as the body tries to get rid of this excess fluid. So these first couple ones here, like we talked about, are really going to be a result of that decrease in the body's ability to move blood forward. But even this increased urine output at night is going to be another thing that's as a result of that backup of fluid prior to the right side of the heart. And so that pretty much sums up our right side and left-sided heart failure. As you can see, looking at these symptoms, there's some very different set of symptoms that you're going to see depending on which side of the system it is that's failing. Ultimately, we're going to see very similar things as a result of that decreased cardiac output moving forward to our patient with that decreased oxygenated blood. But the signs and symptoms as a result of what happens when that fluid backs up before even getting to the heart, that's really where we're going to see some of these key differences and can really be the telltale signs on whether your patient has left or right-sided heart failure. Now, finally, like I talked about, you can also be in a situation where you have biventricular failure, and ultimately you're going to see with those patients signs and symptoms not of just left-sided or right-sided, but in fact both of them altogether. So it is important to know these distinctions and be able to recognize these differences between our left-sided and right-sided, as well as to have the awareness of what some of those causes are and those risk factors so that we can work to help to try to prevent these within our patients. All right, and so that's going to wrap things up for this lesson here, talking about the left versus right-sided heart failure. I really hope going through all this has helped to solidify your understanding of some of these differences between these two types of failure. And either of these types of failure can be a result of that systolic or diastolic dysfunction, but ultimately the way that they manifest themselves will be quite different depending on which side of the heart it is that's affected. All right, and so with that said, I do want to truly thank you guys for watching this video. Like I said, I hope that this information was useful. I hope that you guys were able to take this information in and understand it in a way that really makes sense for you guys. As always, I do invite you to subscribe to our channel if you haven't already, as well as leave us a like if you like this video, or a comment if you just want to let us know, or if you have any questions, we'd be more than glad to answer those for you. Otherwise, stay tuned for the last and final lesson in this series, in which we talk about the diagnosing as well as the treatment of heart failure in our patients. In the meantime, though, check out the last lesson that we did prior to this heart failure series, in which I did a really good breakdown of our Glasgow Coma Scale. With that said, I do want to thank you guys so much for watching, and you guys have a wonderful day.